It's extremely important to keep in mind that hair restoration is a medical art. Medical art combines medical knowledge, mastery of current surgical skills and techniques, as well as a keen eye enabling the accurate reproduction of what occurs naturally. Unfortunately, many prospective hair restoration patients assume that artistic ability is a given, resulting from education and practice of established surgical techniques. Art and surgery are separate skills which must be taken into consideration when evaluating a doctor for your hair restoration. Unfortunately, a large part of Dr. Cole's practice consists of repairing patients who have fallen victim to doctors with little or no artistic sensibilities. To illustrate the critical importance of the artistic component of hair restoration surgery, imagine with me for a moment the quality of result an art restorer would produce if he followed the methodology of a strip hair restoration doctor. After preliminary preparation, the art restorer would carefully remove a strip of paint layer from the canvas. He would then utilize the correct colors of the original paint material to touch up the damaged area on the painting. With a hair restoration strip surgery, the strip is removed, dissected, and the unused tissue is discarded. Nothing is placed back in the donor area and the edges are drawn tight and sutured. Even if there were no scar at all, this procedure causes distortion of hair direction and a loss of the naturally occurring gradation of hair shaft diameter. And it gets worse. Strip surgeons today boast of mega sessions above 8,000 grafts. This means a wider strip is removed, which results in even greater cosmetic problems for the donor area. As a further illustration to confirm this, let's have a look at the following photos of our patient who came in for repair surgery on October 4, 2012. Notice that he wears his hair fairly short and the strip scar is easily concealed by the donor area hair. There does appear, however, to be a rather abrupt termination of natural hair diameter gradation and density. Let's shave these areas down for a closer look. Needless to say, the scar becomes obvious, and this example is one of the better scars a patient should expect who opts for this legacy surgical option. Unfortunately, even a very good strip scar is simply unacceptable to the vast majority of patients. By the way, this is the work of a large, well-known hair restoration practice. Upon closer examination, it becomes evident that not only the natural hair shaft diameter gradation has been disfigured, but the direction of hair growth has assumed an unnatural configuration. As I have just illustrated by the previous art restoration example, with strip surgery you solve one problem and at the same time you create another. This surgical method has never been wholeheartedly embraced by doctors with a strong motivation to provide the very best aesthetic outcome for their patients. And beginning with Dr. Ray Woods, a superior technique emerged. Hair transplant tools and associated technologies have moved forward considerably over the last 10 years. FUE in the right hands with the finest surgical tools provides great and numerous advantages for the patient undergoing hair restoration. Number 1, there is no strip scar. Number 2, the doctor is not limited to using only hair within a small strip. The doctor can use the finer hair available in the greatly expanded resource of donor area to create the most natural appearing hairline possible. Number 3, FUE, or more specifically Dr. Cole's method referred to as CIT, does not cause distortion of hair growth angles or destroy the natural hair shaft diameter gradation that is seen occurring naturally at the back of a virgin scalp as strip surgery does. Number 4, CIT is a far less invasive procedure than strip surgery. Number 5, current state-of-the-art hair restoration includes PRP and ACELL. Used in conjunction with CIT, PRP and ACELL have shown promise in preliminary studies by Dr. Cole and other doctors in accelerating new hair growth as well as minimizing hypopigmentation at the donor sites. We showed you a relatively good strip scar. Now let's take a look at a severe strip scar. If that weren't enough, let's take a look at one doctor's interpretation of medical art. There are only a handful of doctors in the world who have the skills to attempt such a repair. Dr. Cole here in Atlanta is one of them. So far, this patient received 7,976 grafts, mostly from the chest and beard area. This is a work in progress, and the patient will return soon for additional work.